It's been an incredibly fast-paced type of disease response, something that I have never experienced before in my 20-plus years as a public health practitioner and within the last few years as a public health director. I've had concerns all along the way for people's mental health and emotional well-being. It's been incredibly disruptive to all of our lives. There have been some businesses that have had tremendous concerns and that have had to lay off many of their staff. And that is a big hit to our community and a big hit to our mental health, our social well-being, and not on an individual level, but on a community level.
As coroner, one of the things I see that is needed most in our community is assistance with folks with mental illness as well as their families. So I joined the NAMI board a little over a year ago because I felt NAMI was uniquely positioned to provide that support to families and folks with mental illness in ways that really no other nonprofit or agency is capable of doing. NAMI's evolved, like many of us have, quickly to respond to the very dynamic and ever-changing world that we're living in by leading virtual peer-led support groups, extending that support and love across the internet as opposed to being in person.
I think about working remotely. I'm at home and I see the same four walls. My options are I go upstairs and I can see a different view, but it's the same view every single day. I also go around the block. It's the same it's the same walk that I have every day. Well, do I want to go right? Do I want to go left? Oh, this is neat. So I try to pick up on anything that I can to keep my hopes up, to keep my mental health up, but it is a challenge, and I know if it's a challenge for me, how incredibly hard that is on others who are dealing with mental illness, and we need NAMI to help us through this pandemic and to be supportive as we each are dealing with our own mental health well-being. All of us, no one is untouched.
Well, we typically think of NAMI as an agency who's focused on folks with mental health diagnoses, but the reality is we all throughout our lives struggle in times of uncertainty and difficulty and grief. And I don't know that there has been in many generations a single event that is going to impact as many people so quickly and so dramatically as the COVID-19 pandemic. And as we look forward after we get through the virus, as we continue to see success, which we have, that's only the first part of the battle. The second part will be, how do we help our communities and our individuals pick up the pieces and start to build back what we have lost over the recent time, and NAMI is going to play a major role in that in our community. It can sometimes feel like there isn't much that you can do and that you're helpless in this, but in fact you're not. And so we've had people do everything from sewing masks for our first responders to helping their elderly neighbors get groceries or lending hand however they can. But when it comes to NAMI, here's where you can make a big investment and do your part. And we all know, those of us who know NAMI is going to be there for these people, for all of us, when we need them most.
I think it's wonderful that the community has situational awareness and they're paying attention. And as investors making an investment in NAMI, I'm incredibly grateful because it tells me that folks are paying attention not only to the short-term needs, but the long-term needs of our community.
NAMI is going to be in this fight for the long haul, and to do that, they need us. And so in the same way NAMI is here for us as our opportunity to be there for them. Now is the time to do your part for the next phase of this fight. I saw you were going to cough, so I cut it off right there.
Just ate it with that.
I saw this. I saw the sleeve. I saw the shoulder go up, and I was like, ooh. She's doing her social distancing sneeze. Stop it.